Hi folks, in this short video I want to talk a little bit about some of the health outcomes that are associated with homelessness. Now for the most part I'm going to be using Canadian statistics for this. There was a really nice review done and you can see it here from publichealthontario.ca. So I really encourage you, if you want some more information and some more details about this, to take a look at that link. However, I'm basically going to be summarizing in this short little video some of the main outcomes that they found. So when we think about homelessness and health, think about it as a bi-directional relationship, right? Being homeless can definitely have impacts on one's health, and we'll get into that, and makes somebody much more at risk for a number of different conditions. The other aspect is that health issues can result in homelessness as well, particularly when we're thinking about mental health issues, lack of social support, or as we saw earlier in some of the videos, if there's a sudden decrease in one's health and they're not able to work anymore nor get support. So how can homelessness affect health? Well, there's a few different ways, right? As we saw earlier, there's 5 shelters in London, Ontario. If these shelters are crowded, they can expose individuals to communicable diseases. Furthermore, most individuals who are homeless might be on their feet for long periods of time, and prolonged exposure of their feet to the cold and moisture can lead to infections. A lot of times, obtaining medication and adhering to medical recommendations can be difficult due to a number of different factors, such as having no fixed address, maybe not having a primary care physician associated with this homeless person. And the other aspect is that a lot of times the priority is finding food and shelter. So the treatment and prevention of health issues then kind of gets put on the back burner and is really only addressed when it becomes untenable otherwise. So how can health impact homelessness? So if we think about this, certain health conditions can influence the onset of homelessness and worsen the homeless state. In this particular course, we talked a little bit about some health issues such as addiction. We talked about psychosis. You can imagine if somebody is dealing with these, this would also worsen the homeless state. Substance use and a lack of social support can influence the likelihood one may become homeless. A lot of times, the rates of homelessness among men is higher than that among women, and part of the reason for this might be due to lack of social supports. And overall, homeless individuals have a reduced life expectancy by quite a bit. Now, what about specific health outcomes? Well, in this really nice review, they looked at a few different types of health outcomes and did some evaluation of primary literature across a number of different fields. So they found that infectious diseases, in particular STIs and HIV, hepatitis, and tuberculosis, were increased among homeless individuals. Mental health issues of the homeless population that was surveyed. Now, this is in Germany, but I think this is relatively, in some ways, equivalent to what we might see in Canada. Those mental health issues were 77.4%. And the most common mental health issues were alcohol dependency, personality disorders, anxiety disorders, and then there at the bottom, psychotic illness. So as you can see, there's kind of some myth busting going on here as well, that a lot of times I think that homeless individuals can be portrayed as having a lot of psychosis. But if we look at the most prevalent, that's not the case. Alcohol dependency and personality disorders are far more prevalent than psychotic illness among the homeless population. For cognitive function, homeless individuals often have a decreased performance for attention and general functioning, but interestingly, they've been found to have higher levels of creative thinking. And if you think about this and the circumstances within which these individuals live, this makes sense. Nutritional deficiencies are quite common, again, because of a lack of access to clean or to healthy food. Foot issues, as we mentioned earlier. Hypertension and diabetes are also common within the homeless population, but not at a greater rate than what is within housed populations. And finally, injuries. So if we think about access to healthcare, it makes sense that injuries would be fairly common among individuals with homelessness. They are a lot more exposed to the elements, and because they may not have a primary care physician or good access or ability to seek healthcare, then injuries are fairly common. Now, the reason that it's important to think about health issues impacting homeless individuals is so that we can plan and provide necessary services. So we can understand the issues that are affecting these individuals and best support them so that they can live their best possible lives.